Non-pharmacological interventions for dementia-induced psychosis for the nurse practitioner. Welcome to the education module, Non-Pharmacological Interventions for Dementia-Induced Psychosis. In this series, the terms persons living with dementia will be used to emphasize that dementia is a diagnosis and does not define the individual. Dementia is a highly stigmatized disease process. The term persons living with dementia is used to promote positive language and a more person-centered approach. The purpose of this module is to discuss non-pharmacological interventions for persons living with dementia-induced psychosis. Dementia influences important aspects of daily life, such as autonomy, activities of daily living, and the ability to perform meaningful activities. Dementia dramatically changes not just the lives of the persons living with it, but also their families and society. There is no known treatment modality, either pharmacological or non-pharmacological, that can cure dementia or halt its progression. As there is no cure for dementia, the main goal of caring for persons living with dementia is the maintenance and promotion of quality of life. A non-pharmacological intervention is defined as any sort of intervention not directly involving medication and attempting to optimize complex healthcare needs or to better manage chronic illness. For this module, we will be looking at non-pharmacological interventions that aim to mediate chronic illness and promote quality of life for persons living with dementia. Non-pharmacological interventions slow the spread of community illnesses such as COVID-19 or the flu. Risk is all around us. The focus of a management plan for mitigating COVID-19 or the flu is based on keeping staff and patients safe. It is important, however, to remember that it is impossible to eliminate all risks completely, but any effort towards mitigation can be tremendously positive for all involved. Non-pharmacological interventions are sometimes referred to as complementary and alternative therapies. These can be self-directed and also self-administered. Non-pharmacological interventions frequently flow directly from the cause or etiology of a symptom that induces a behavior. For example, sensory function can be improved by encouraging the use of hearing aids and eyeglasses. Non-pharmacological interventions can enhance quality of life. Non-pharmacological interventions can also decrease the number and intensity of dementia-related psychosis symptoms that generally lead to an emergency room visit or hospitalization. Non-pharmacological interventions can also decrease pain. There are a variety of evidence-based practices that can be used by advanced practice nurses, including distraction, stress management, art, animal therapy, horticulture, massage, and physical or occupational therapy. Distraction is taking a person's attention from what is causing an issue to something else more pleasant. Not arguing or changing the subject or going to a different room are good distractors. Stress management can include guided imagery, relaxation techniques like deep breathing, or gentle movement such as Tai Chi or massage. Evidence-based practices are person-centered and depend on what the person enjoys. Adult coloring books, sculpture, or crafts can be utilized. Music may help increase energy levels and improve mood. Music may help reduce pain by triggering the body to release natural chemicals called endorphins that decrease pain. Music may be used with any of the other techniques, such as relaxation or distraction. Pets are incredibly therapeutic and can be any kind of animal or living thing that the person enjoys. The act of petting an animal helps with distraction and relaxation. Nurses have used massage since the time of Florence Nightingale to reduce pain and induce peaceful sleep. Physical therapy or occupational therapists also use massage to improve the movement of joints. Meaningful activities include any physical, social, or spiritual activity that are individualized to meet the needs and preferences of the person living with dementia. What do they enjoy? Participating in meaningful activities helps them feel good, and that feeling supports well-being and independence and gives purpose to life. Deep breathing can help a person relax and even decrease pain if this is a symptom. Gel packs can be made cold or warm, but never hot. Sensory stimulation therapy helps to relieve dementia-induced psychosis. Sensory stimulation is the activation of one or more of the senses, including taste, smell, vision, hearing, and touch. It can range from something as simple as a hand massage with scented lotion, or listening to a playlist of favorite music, to more complicated activities designed to provide sensory experiences. Sensory stimulation can call up positive memories and emotions and encourages communication and engagement with reality. Non-pharmacological interventions, such as psychosocial interventions, improve cognitive abilities through cognitive stimulation and training. Activity planning and reminiscence enhance emotional well-being. Aromatherapy and music help to reduce behavioral symptoms. Occupational therapy promotes everyday functioning. Support groups are a wonderful way to interact with others who are living with or caring for a person with dementia. Reminiscence therapy is an effective intervention that advanced practice nurses can recommend to caregivers. Reminiscence therapy uses photographs, familiar items from the past, music, and movies to stimulate the memory of the person living with dementia. Short-term memories are more difficult than long-term memories for the person with a diagnosis of dementia. Reminiscence therapy encourages discussions about past experiences. Recall encourages preserved abilities and decreases feelings of inadequacy. The advanced practice nurse can recommend physical activity, and increasing activity promotes functional abilities and therefore stimulates cognition. It is important for the advanced practice nurse to educate caregivers about maintaining a consistent routine and familiar environment to decrease dementia-related psychosis. Changes that could be carried out include ensuring adequate lighting and avoiding glare, labeling drawers and cabinets, ensuring easy access to toileting, providing privacy and avoiding overcrowding and clutter, as well as having a prominent clock, calendar, and daily schedule to improve an orientation to time. Consistent caregivers are also important. Non-pharmacological interventions should be considered before pharmacological interventions. Non-pharmacological interventions encompass a holistic approach that thinks about psychosocial, spiritual, cultural, and environmental aspects that are unique to the person living with dementia. Research has demonstrated that agitation, aggression, disruption, shadowing, depression, and repetitive behaviors can be improved with the use of non-pharmacological interventions. Older adults diagnosed with dementia-related psychosis are all unique with their own history and their own life experience. Treatment and management plans must be individualized based on the person's needs, values, preferences, and they are tailored to the specific type of dementia. Advanced practice nurses play an important role in decreasing dementia-related psychosis. Advanced practice nurses who learn the art of individualizing non-pharmacological interventions will improve the quality of life for the persons living with dementia and caregivers. While there is a growing number of studies and reviews of studies of non-pharmacological interventions in dementia, there is an information gap in the overview of interventions or group of interventions and how effective they are and why. It is important for the nurse practitioner to remember that what works today may not work tomorrow. There are no recipes to follow. Document specific, successful non-pharmacological interventions. Advanced practice nurses are positioned to recommend different non-pharmacological interventions. Just because the person living with dementia may not have enjoyed the intervention before, they may enjoy it now. It is important to include family members in the plan of care, or even better, ask input from the person living with dementia. There is always hope. New non-pharmacological interventions and even medications are being researched all the time. Advanced practice nurses who want to know more about neuropsychiatric symptoms and syndromes are encouraged to participate in the Dementia and Neuropsychiatric Syndrome series with content provided by experts from the Gerontological Advanced Practice Nurses Association and the GAPNA Geropsychiatric Nursing Special Interest Group. Thank you for your attention.